Good afternoon. This is Dr. Swami Iyer. I'm at the IACA booth and I'm here to interview Dr. Arnab Basu. Arnab Basu is a fellow in experimental therapeutics at Cleveland Clinic. Welcome, Arnab.
Thank you so much for having me here. It's a pleasure.
So, Arnab, tell me, you have a poster which is very interesting that I thought looking at your data. It's platelet function and how it correlates with outcomes in patients with cancer. So tell us a little bit about the background and your findings.
Sure. So, as we know, thrombosis in the setting of metastatic cancer is a significant cause of mortality and morbidity. In fact, the leading cause of non-directly cancer-related mortality and morbidity is thrombosis in cancer, and has been a subject of much deliberation over the past few years. We've looked into what really causes cancer-associated thrombosis, and there have been many hypotheses related to inflammation, related to the coagulation factor production, and so what we did in our study was really look at another component of the clot, which is the platelet, and see whether the behavior of the platelet is any different in patients who have a higher chance of having clots, for example. So there has been a validated system that has been developed by Dr. Khorana at the Cleveland Clinic and previously at the University of Rochester, which was the Khorana score. And it was really looking at the risk of venous thromboembolism in patients who are getting chemotherapy outpatient. And what we were looking at here was how are platelets behaving in patients who have a higher risk of thrombosis, modeled by the Khorana scores.
Excellent. And so what have you found so far?
So the results actually have been quite interesting. What we did is we got 25 patients in our outpatient chemotherapy setting who form the population that the Khorana score was validated on, and we collected blood from these patients in a proper fashion to make sure that we don't have any iatrogenic platelet activation, and we run this through platelet aggregation studies in our lab at the Sinai Hospital. And what we saw was there was a very strong correlation between increasing amounts of aggregation with higher amount of agonists, which were ADP, collagen, and arachidonic acid in this case. And they correlated very well with their Khorana scores as well. So, and these were statistically significant at very small numbers, in fact, and they were all significantly less than 0.5.
Excellent. So the implications, if you can put it in a nutshell for people who are wanting to use aspirin in this setting or not using aspirin, and of course there's this whole question of whether preventing thrombosis also improves outcomes in these patients. How do you put this in perspective?
Yes, I think that's a great question, and I think this opens up the role of anti-platelet strategies towards the question of preventing thrombosis in high-risk patients. There have been some new trials, such as the PROTECT trial, that has explored low molecular weight heparins in the prevention of thrombosis in these high-risk patient populations. Now, as we know, the risk with heparins is the higher risk of bleeding and the higher risk of adverse events. And now if we find that there is a platelet-mediated effect as well in thrombosis, maybe this opens up the role for having aspirin or anti-platelet therapies in a selected population with higher risk.
So that's very good. But if you look at the studies in myeloma, the initial studies in multiple myeloma used simple baby aspirin as prophylaxis. So, and it seemed to work to a certain extent. So it looks like you have some additional data to show that, and all the best for all your future work.
Thank you very much.
You.
It's a pleasure to be here.
Thank you.